So now, welcome to today's event, and I'm really very happy that Jackie Cassell is able to join us again with her medical expertise and answer a few questions, burning questions that we all have on how this pandemic is going to develop. So Jackie, will you just tell us in a few words about yourself and your background, please?
Yeah, thanks, Barbara, and I'm really delighted to come and a second time. So my background, I'm a medic, and I trained in sexual health, and then I trained in public health medicine, and I have been working in a range of things, so sort of contact tracing in various domains, including infectious disease control, but also sexual health. But the last 12 years or so, if you look me up and if you put my name and the word scabies into a search engine, you will find my work on outbreaks in care homes, outbreaks of scabies in care homes, and that has brought me very firmly into the domain of advising on COVID. But I'm a kind of general purpose infection control and public health person, and I've also done some work on quality of life in care homes and how we improve that. And in my other life, I play the violin and I also sing. So that's been my other world all my life. It's another world, another career that I almost went down, and so now I try and stay in both worlds. So thank you, Barbara.
Okay, brilliant. Thank you, Jackie. So I've just collected a few questions that I will put to you, and I'm sure attendees will have others to ask later. So really a general one. With your medical knowledge and understanding, what are your thoughts on how this pandemic is developing in the coming year? How much longer can we expect not to be operating normally, whatever that is?
Yeah, so obviously, I mean, I think the big thing we're going to see internationally is huge variation in how the epidemic goes. But in the UK, I think there's a really good prospect that in terms of infections, and most importantly, in terms of people getting significantly unwell with COVID, this is really going to go down. I mean, the thing that's been really striking about the vaccines is how incredibly well they protect against serious illness and hospitalization, and that I think is beyond the trials and beyond expectation. So that is really exciting. I think we will also see, I think in the coming months, some more anxiety about the role of young people, both children and young adults, as we will see a growing proportion of all infections, and indeed of those who get serious illness in younger people. So there'll be fewer sick people, but they will be younger. And I think, there's going to be a lot of emerging anxieties. And the thing that's been really striking is just the kind of extent of polarization of responses, and really just how incredibly anxious many people continue to be, despite still low personal risks. I think, and I do think that music, and particularly choral music, it really just brings to the fore a lot of the kind of cultural and scientific issues at the heart of the pandemic. And I think it's going to be really challenging to get perhaps to the level of measures that might be justified as the vaccination program rolls out. I mean, I would say that, there are already trials of boosters. If you're looking for I think it's called the Cove Boost trial, that's recruiting in 15 areas around the country. But if you talk to the immunologists and virologists, I don't think anybody expects a variant to come out of the blue that overwhelms vaccination. Total vaccine escape mutant does not look in near prospect. I think I'm not a virologist, immunologist, but that is the consensus I hear from those people. And so in the long term, confidence in the vaccine program and the already substantial work that's going on in the background to make sure boosters for those who need it are ready for new variants, those are the two things that matter. And I would say in the long term, like beyond the autumn, those are the only things we should worry about. So what I would conclude by saying is that I think a really important part of public policy is trust in the vaccination program, and I think there's some interesting issues around that, but also trust in the vaccination program delivering normality. And I think that's something that scientists and policymakers are hugely struggling with, because actually, if you want to keep people on board with vaccination, it's got to free up the things, people to do the things they always wanted to. And I think music is a bit of a kind of at the heart of that cultural issue, which is beyond the science.
Thank you, Jackie. That's very interesting. I think you're right. You know, if we're all being asked to go and get the vaccination, how are we benefiting? You know, that I think that's what you're saying. So I guess following on from that, I mean, is it actually? I mean, that's perhaps not in your expertise. Is it sensible to vaccinate younger age groups? Should we all have these vaccination passports that there was a brief consultation about? What do you have any view on that?
Yeah, I mean, I do think, I mean, the point I was making about trust in the vaccination program, I think it's really important, and clearly Germany has recently decided not to vaccinate younger teenagers. What we do know about transmission is that above the age of 12, you have standard transmissibility. But under the age of 12, children seem to that they basically shed virus for a shorter period and not so much of it. And it's quite unusual to get your virus off a child unless you had very close contact. So there are some interesting, so in terms of vaccinating children, I think there is a real issue that will be a societal one about, do they benefit and for whose benefit. I think more broadly about vaccination, there's anti-vax movements are not very big in this country, and we do have one of the most trusted vaccination programs in the country. But if you're going to ask people to come back and back, and we may have to ask people to come back, it's really important that people have confidence and do not feel this is being used inappropriately. So I think there are issues about vaccine passports and trust. And, when did you last get asked about your measles status? We don't get, so measles is a horrible thing. If measles landed now, it would kill a lot of people, but the fact is they're all immune through vaccination. So there is something about normalizing our relationship to the vaccination programs that we already have. So personally, for those reasons, I'm not in favor of vaccine passports. I think they will be stigmatizing to people you really want to keep on board. And when I listen to people on social media, and indeed people I know, talking very negatively and mistrustfully about vaccination program, I cannot see that that's a good way to go with my public health hat on.
Brilliant. Oh, yeah, no, I am unmuted. I was like, yeah, thank you for that. So I think, again, you've started touching on this. Most groups that are already meeting are employing a lot of different mitigations. They're looking at ventilation, they're looking at masks, they're looking at social distancing and hand hygiene and all those things. But now that we have the vaccinations, and in England also the free lateral flow tests that everybody can access for free, do we still need anything else, do you think?
I mean, I think that what we've seen in care homes, for example, which are a particularly vulnerable setting, is that the chances of getting an infected person in and creating further infections is massively it's related to how much there is around generally. And as you get less COVID around, then the performance of these various tests reduces. So I think it's so I don't think there is anything else you can do. And I think we will be getting to the point of really questioning the value of some of those things. So for example, there's been some, very competent expert view very recently that that the lateral flow testing in schools is really not helpful. Perhaps it wasn't before, but it's certainly becoming unhelpful as prevalence is going down. So I think it's absolutely right to have all those things, but I think we will soon get to a point where the trade-offs and indeed the utility of many of those may shift really quite quickly. I mean, I think confidence in the vaccinations, I feel this particularly very recently, is growing. And I think, and so, you know, I don't think there's anything else people should be doing. I think it's also, I mean, I know that Making Music has been great on this, but there's, you know, going down the road of collecting personal data is not something that we want to do, and certainly normalizing that long term. So I think that there's a question about when's the right time to reconsider, and I suspect that will come in the coming months.
Great, no, thank you. And I think also the danger is if you persist with other mitigations for longer than they're needed, then actually people aren't going to follow them properly anymore, because they'll get complacent, going, well, what's the point? And then when they are necessary again, say in the autumn, there, you know, there will be a level of complacency that is difficult to counteract, I guess. So thank you for that. And so I've got another question which we get asked quite often, which is about the different variants being more transmissible. Now, what does that mean?
Yeah, what does that mean? I wrote a blog about that actually, which is still up, when the Delta variant, what was then called the Kent variant, came up. I mean, there's various things it might mean. What R naught means, what the R number means is and I talk about this a lot in the context of sexually transmitted infections, where you don't have immunity by and large. So basically, if you drop an infection into a community where there is no immunity, then you get, for measles, it might be, say, 40 cases, because it's coming off your eyes and your nose and so on. And so what determines R naught? Well, there's three elements, one of which is transmissibility given the right kind of contact. So that might be sexual contact, it might be sitting next to someone at a rehearsal type of contact, depending on the disease. So it's the probability of contact, and then the number of contacts you have of the appropriate type, and then also the period of infectiousness. So the period of infectiousness is quite important. The probability of getting it, given you're in the right sort of contact with somebody, a lot of that is to do with the virus itself, but also to do with the viral load. So this thing about children not shedding for very long and not shedding very much means that you're less likely to get it off the child. So those are the elements of transmissibility, all of which contribute to the R number. And of course but it's important to recognize that R is calculated originally for a non-immune population. And so with vaccination, you shift all of those things. So vaccination reduces the period of transmissibility. Some people might get infected, but so briefly that nobody ever knows, and they don't get to pass it on. And then other people, and the transmissibility per contact is reduced even if they are. So it's those three elements that make up transmissibility, and and beyond that, it's to the kind of detail for the virologists and so on to give.
Okay, and so I mean, there was also, sorry, this is a bit of a follow-on, I guess, that some people seem to shed more than others. So is this about how much they just have per breath or whatever it is that they?
Yeah, I mean, I think yes. I mean, it's an interesting one, because I think there clearly are people who infect far more people than others, but that is much more about behavior, including what job they do, what housing they live in. A lot of that is about environment. So one, I think, really key point is that there have been no super spreading events without an indoor component. Super spreading, so there is, so that's really. Could you just remind me of the last bit of that question, because I've gone a bit off on one.
No, you are. So it so really, in what way are some people more spreading more? Do you know what I mean? Do they have more virus per breath or something? That's what.
So it's probably largely situational, but if you look at the graph, and this is very typical for any viral illness, within shortly before and shortly after becoming symptomatic, you're shedding a lot more virus. And some people either don't get symptoms or don't recognize symptoms, but it is thought that you're much less likely to transmit if you don't have symptoms. So that would be the pattern. And so if you had, just like in HIV, if you had somebody, if you come across someone who's at that phase in close contact, in an environment where the ventilation isn't good and so on, then you will have a greater chance of getting it from them. But super spreading events tend to be quite unusual events in terms of what we do every day, unless you're unlucky to be working in certain sorts of settings, or indeed living in certain settings. So, for example, we saw that awful outbreak in the barracks in which migrants were being housed. So those tend to be where you get them.
Great, thank you. So do you, are you able to shed any light on, are people getting COVID for a second or third time? How they're being affected? Does vaccination mitigate there? Is there anything that the scientific community already knows?
Yeah, I mean, it looks as though it's pretty rare, even if there's a lot of COVID around, for somebody to get COVID a second time. And certainly both vaccination and previous COVID infection both substantially reduce your chance of getting infected at all again. And some people, I think, and so if you have COVID and one vaccination, you're similarly at very, very low risk again, because the vaccine does work slightly differently. But it's like, I mean, I think the most natural example is chickenpox. So chickenpox, you get it once and you might get shingles again because it lives inside you, but basically the virus persists. But it's very unusual, but it does happen for people to get chickenpox again. They tend not to get it as severely, and they tend not to be so infectious. So it's probably going to be a bit like that until we get a completely new variant, which is clearly some time off.
Okay. Brilliant. So one question I had, this sort of follows on from that a little bit. Are there different symptoms, I think we're being told now, for the Delta variant that we should be looking out for? Do we need to incorporate that in our pre-rehearsal questionnaires, etc.? Do you know?
I think I wouldn't do that justice. I mean, I think it has been hypothesized that that with the level of the rollout of the vaccination program and the Delta variant, it may be that we're seeing slightly different symptom clusters. I think where you have something as common as headache or runny nose, and I think the other thing to bear in mind is, of course, that other respiratory viruses are going to come back. They have been terribly, terribly suppressed, and we're going to see those coming back. So I kind of think I would just wait for any guidance on that, because it's going to be a complex picture of respiratory viruses of all kinds in the coming months, I think.
Okay, so I mean, because that was one of the questions just now in the chat, so the NHS haven't highlighted those yet, so we don't need to worry about those for now. I
wouldn't preempt that, no.
Okay, so these are the questions that I'd kind of already gathered from you folks. Sharon, do you want to jump in here and tell us what people have been asking or would like to know about?
And I'm on an iPad, so I can't see the chat, so I do apologise if I'm not picking up on things in the way I normally would.
Sure. No, Sharon will.
Do you think that antibodies from vaccines will diminish in the autumn, making it a danger period when we otherwise would believe we're all okay?
Okay, so there are two elements to immunity. One is antibodies, which is easy to measure. You get a blood sample or a saliva sample and you can say whether they're there or not. And then the other thing is what they call T-cell immunity. And so, for example, for the hepatitis B vaccine, over a period of time, your antibodies go down. But if you give somebody a new vaccination, they'll immediately go up very, very high again. And so that's why over, those of us who are a bit older, over our lifetimes, we've gone from repeating the tetanus vaccine every 10 years or whatever to saying, no, once you've had 4 lifetime doses or whatever it is, that's enough. what that recognises is that a huge component of immunity is the bit that you can't measure through antibodies. And on the one hand, that makes people a bit nervous because you can no longer find the antibodies. On the other hand, it should give us hope for the future, because it does mean that there's this whole invisible armory that can just kick into action as soon as you're exposed to something. So the answer is antibodies may well go down, but it probably doesn't matter.
Okay,
Great.
you.
Thank you.
Are there any indications about when social distancing during rehearsals may be reduced, particularly if the majority of our members are vaccinated?
I think my personal view, as somebody who does kind of various sorts of advisory group, is that I think music in multi-use spaces is proving really quite a challenging one. And I think it will be really important for the community to reassure public health. I mean, to write to your local public health directors, telling them how you run choirs, because I think people need to understand just how well regulated and how contact traceable a choir is. I mean, that's not it, and the reason I think that's so, a number of things. As a medic, we are much more reassured by individual level interventions, vaccination, a tablet, a mask or whatever, something you can do to an individual. And we are less good at and less comfortable with what we call structural interventions. And that would be, so things like ventilation, we medics feel less able to say, yeah, this is okay now. And as I give you, an example related to that would be if you're a child who lives in a hard up family, you're many times more, several 10, 20, 30, 40 times more likely to die of an accident in early childhood. And that's just because the environment you live in. So I do think it's a really difficult space, because people feel they understand what a football team does. They understand what a lot of activities are. So and also many activities are in dedicated spaces. So I think there's a huge hearts and minds thing to be done about educating public health people about these kind of activities, really, because I think it's not rational, but I think it doesn't lend itself to the kind of standard risk assessments that we're used to. And I'm incredibly impressed by the really comprehensive and detailed and accurate and well-informed approach to risk assessment that Making Music has had around for a very long time now. It covers all aspects, but it is a complex, it's a kind of complex activity. And I think that at some point, I think it would just look slightly mad to be excluding singing any longer. But I think it kind of, I don't personally fully understand where the 6 rule is coming from, given the other activities that are allowed in larger groups.
Okay, the next question is 3 questions in one. So what is the latest research on droplet transmission and singing? What is the relationship between droplets and airflow? And is there any research around evaporation of droplets when outside?
Okay, I mean, I think you may have other people in this group who would have a more informed view on that. I've not been following the droplet stuff hugely, but what I think is really clear is how important ventilation is, and how little most of us have kind of thought about it in our daily lives before. I mean, even in hospitals, it proves challenging. So what I do think, though, it's not so much what do droplets do or not do, it's that, do we have an improved understanding of where transmission is going and in what kind of context? I think it's fair to say that there's less anxiety about fomites, shared surfaces, in most settings than there was a few months ago. So licking, getting things into your hands and mouth through what you've touched. That's probably a smaller component than we thought. Years. And that I think underlies, which means that a greater element of anxiety is around aerosol, and that is a harder thing to think about. So but I'm not the expert I'd like to be on that kind of stuff, so I wonder if somebody else might. Even last time we had somebody really on top of this in the audience.
Okay, if you're on top of that, pop something in the chat and we'll come.
I don't know. Anybody coming forward? Yeah.
Okay,
yeah.
So Barbara, the next few questions are probably more aimed at you, because there are a few people asking about the restrictions around the insurance and things like that. So for example, if we are rehearsing to perform and we're making money but we're giving it to charity, is that still allowed? Is that a commercial activity?
It is, because clearly you will be allowed to do whatever you want with the money that you make from your commercial activity, and you may be choosing to give it to charity. So.
Okay, and is it legal or permitted to have a requirement that people who attend an event have been double vaccinated or have a negative test?
That's not legal to my knowledge at the moment, but actually Jackie may have a view on this as well.
I mean, I just point to the that there is a specific data protection law around processing health information, and so I don't know where policy will go in terms of who can exclude and not exclude from what activities, but I would be very careful about collecting any information at all about health status, which includes vaccination status.
And I would also add that, you may be accused of discrimination, because there are people who can't and also have a right not to have the vaccination, so you are in charge of your own body. So you could decide that you would not want to have it, but this would be discriminatory then if you exclude people on those grounds. Aaron?
Thank you for clarifying that. Jackie, back to you. What is the medical community saying to DCMS about the disparity in management between choirs adhering to COVID guidelines and crowds of hundreds of singing football supporters in pubs?
I think, doctors are part of the rest of society, and I think a lot of us feel that we can't see the difference between these sorts of activities and others. I mean, there will no doubt be people who, there will be people who, I assume, who understand why that specific exception was made, but I am on top of no information that would make this obviously the only way to go. I think that's what I can reasonably say.
Yes, and we've been trying to find out, and we can't find out yet. So we're not asking the right person, possibly. Sharon.
Okay, so given that you're sort of saying it's best not to ask people if they've been double vaccinated, how will the vaccine passports work, and how do you marry those two things up?
I mean, I think it's very unlikely we'll have domestic vaccine passports in the UK. I mean, I don't know what will happen. I mean, the care homes consultation got very mixed responses. Clearly, as reported, one of the issues that came through from respondents was that actually, why just care home workers and not the NHS workers who work with exactly the same patients? It's interesting. I mean, I think there are, where you have kind of close contact, there's a need for proper occupational health, and I think that there will be a growth in health support, I hope, for social care, as there is in the NHS. The NHS has not mandated vaccination. There are very few required vaccinations in NHS, and so when you kind of look in that context, it seems really unlikely we'll be enacting this just around COVID, just at this time, given the potential alienation from other aspects of public health policy. I mean, I don't see it happening, but I think there may well be some specific circumstances which will also challenge people around other sorts of, the other sorts of health protection, really.
Okay, thank you. Is there an acceptable?
Thank you, Sharon. Where are we up to?
Sorry, is there an acceptable proportion of members in terms of vaccination status?
Well, I think it's important to reflect on what vaccination is meant to do. So, you look in care homes at the moment, and a very, very high proportion of all residents have been vaccinated, and that protects them very substantially, to some extent against getting infected and certainly against getting ill. So, I mean, the idea of vaccination is for people who are vulnerable to be getting really ill, getting ill. And then there's the kind of question for the choir leader, which is, wouldn't it be awful if my rehearsal, my choir, was the centre of an outbreak? Well, I think in relation to that, it's worth reflecting that what we're also seeing in care homes is that outbreaks are smaller, and they're smaller because those chains of transmission are being broken, because you haven't got two non-immune people sitting next to one another. So I think I think in the long term, if everybody who wishes to be vaccinated and is vulnerable has been vaccinated, then it's sort of, you get to the point of, we say don't come if you've got a cold, don't come if you've got influenza, but we will have been, people will have been vaccinated. So I think there's not a scientific answer to that, but I think it's very important that members of choirs are aware of, that's going to be the choice space. If you've not had your vaccination, you are vulnerable. This might not be a safer place for you as it is for other people. And that goes for every area of their lives, really.
Absolutely, thank you.
Okay, are we closer to really knowing how and where most transmission happens?
So I think there is a very nice paper. It came out about the 19th of December last year, and it's by the Nerve Tag group, and which is the new and emerging respiratory viruses advisory group, and they talked in considerable detail about what are the high transmission settings, obviously at a time when there was quite a lot of COVID around. And I think, what's really striking when you look at the guidelines is there's a relative lack of emphasis on how you get somewhere. So a lot of transmission goes on where people are congregated through on the way to, for example, sharing vans, a lot of sharing vans, working together in a warehouse, living in overcrowded accommodation. What we absolutely see is that you've got a certain proportion of people who have a lot of contacts in their lives, and a lot of, so some of us who are largely working from home have a small number of household contacts that are kind of, you're with a lot, and then you go out to, you might go to the shop, go past a few people, but where you've got quite a lot of fairly prolonged contacts and you don't have a choice about that, that's where outbreaks start. And then how far they get depends on vaccination primarily. I mean, every area saw large second surge, but that did affect those of us who can work from home much less. So basically it's compulsory prolonged proximity that really drives transmission, whether that's whatever the nature of that, really. And so when you're so things like how you get is a really big deal.
Yeah, no, absolutely. So public transport, for instance. Yeah. So
okay, we have a group who are having their first rehearsal on Monday in a rugby grandstand. So obviously this has an overhang and it has raked seating, but it's exposed to the elements. So they're asking about what is your view on them wearing face coverings in a rehearsal in a rugby grandstand?
I guess it depends on distance, really. I mean, if you're going to stand, there's many ways of doing something that is effectively outside. I mean, that would meet, I mean, there's the kind of Marquise guidance, which says that you've got to, it counts as outdoors if you've got, I think it's do check this, but I think you have to have 2 sides out of 4 open to open.
Yes.
So, I mean, so I would have thought a rugby stadium would meet that on those criteria. But I mean, I guess the kind of proximity stuff would determine it. But I think it's, you'd be jolly unlucky to get significant transmission like that. But you'd certainly want to be thinking, well, are people going off and going to the pub afterwards? Are they traveling in the car together? I mean, it's just getting increasingly difficult to separate that risk from others.
Yeah, but so, I mean, generally, Jackie, we've been saying, obviously that, you're required to wear face coverings indoors in most settings, but not outdoors. So we're saying to people, stick to the social distancing, but you don't have to wear masks if you're 2 meters apart outdoors. This is just outdoors. Would that seem fair enough?
Yeah, absolutely seems fair enough. Yeah.
Sharon, where are we?
Okay, yeah. So there are a lot of questions and I don't think I've dented them yet. So I'll keep going. How can orchestras best handle the different risks for wind and brass players versus string players?
I don't know, Jackie, do you want me to answer that?
I think you'd better answer that.
Well, only because, so we have discussed aerosols quite a lot in the past, and so it's now not thought that wind or brass instruments do actually emit a significant amount more aerosols as such. I mean, flutes are probably what do you call them? These flutes like you play, Sharon. They, the players emit the most. But obviously, string players are still breathing, and then they're nicely stirring the aerosol soup with their bow arms. So actually, everybody who's in a room contributes to the aerosols. And therefore, we would say, that you can possibly seat people a bit differently. My brass band have decided to put the trombones at the front because they might be emitting a little bit more. But otherwise, everybody should be wearing masks, basically, because the string players are also breathing. Well, we hope they are.
And following on from that, Barbara, do you have guidance on a floor plan or a suggested setup?
What for so mostly, I mean, Jackie, you might also, but suggestions have been to use staggered, so not to put people directly in line with each other, and obviously at with a 2 meter radius. I mean, in Germany they're actually only going a sort of 1.5 meter radius, but 2 meters does have some scientific background as far as I can make out. So yeah, Jackie, you probably got something on that.
I haven't got anything to add on that. I certainly don't want to be making up guidance on the hoof.
But that's the reason we've stuck to the 2 meters, is that that seems to be an agreed thing, that certainly droplets don't travel further than that, and it gives aerosols a chance to hopefully rise away from other people. Sharon.
Okay, so why have some outbreaks happened in places like meat processing plants?
So meat processing, so places like meat processing plants, so they are cold, they are quite, they have quite sort of damp air, but importantly, they are places where people have been working, moving around. Some of those outbreaks, not all, were found to have sort of inadequate social distancing measures, but certainly virus, basically the way you inactivate a virus is to dry it out. So anywhere that's cool and poorly ventilated will keep virus around for longer. I'm not aware of the details of what they found on ventilation systems and so on, but again, if you have a temperature controlled environment and it isn't well ventilated, that does, it increases the the life of the virus. The other thing is cold surfaces. So if surfaces may have some contribution, but if you have cold surfaces, then you may have increased viability. But also people, again, this para work thing. Do people go out for a fag together? Are they huddling in a lot of the kind that clearly the kind of between work and home and between work and getting to your car, clearly that's quite important. And we tend to focus very much on the thing itself, the warehouse, but there's the people in and out of it all the time. So these are always really quite complex investigations.
Okay, this is an interesting question. So many groups are sort of saying to their members, if you've got the symptoms, the classic symptoms such as a sore throat, a new cough, don't come to rehearsal. But obviously now there are being some new symptoms reported with the new variants, the headache and the sneezing, which seem to be more in younger people. NHS are not yet highlighting these as top symptoms. So what is your view on this, and should we be highlighting these new symptoms to members and asking them not to come if they have them?
We did actually answer this, Sharon. I think that must have been when you were distracted. Okay, so no, the NHS haven't yet taken them as official, so don't worry about them for now.
Are lateral flow tests accurate enough?
So lateral flow tests, it depends what it is that you're trying to do. Lateral flow tests will miss some people, but they will probably help you identify highly infectious people. But the point I was making earlier is that as the prevalence, the percentage of people who've got an infection goes down, then you get an increasing number of false positives in the test that you give. And this is a huge issue for schools. It's a huge issue in lots of settings. So the answer is, even if they did, they probably won't for much longer. And certainly as the disease is further controlled, the false positives do create real issues. So I think it's just, I think there isn't a single answer to that, to be honest.
Right.
Okay. How useful are bell covers for wind and brass instruments?
Barbara, you're probably better on top of that.
Well, research last year showed that they could provide some protection. So this was something that was done here, but I think Brass Bands England were leading on that, but also the Americans, the Colorado study, I forget what the exact title is, they did something on that and said that they found them useful. Having said that, of course, if you then need to use a mute on your instrument, that's a little bit tricky, I've just found in my rehearsal, because I do use bell covers on my trumpet. If in doubt, why not try? They cost a couple of quid. They're not an expensive thing to get, so you could.
I'm just going to say that I also attended an online seminar which was run by some people in France. They did speak in English, fortunately, but they had some research that proved that bell covers were effective, so worth using, definitely. Barbara, there's a few questions about commercial activity. So you've already answered the one about giving money to charity. There's a group who have a youth choir, but the leavers over 18 are currently excluded. Can they now include the over 18s because it's a commercial activity?
Sorry, Sharon, I missed the end of that because my internet, I think, was breaking up.
Okay, so it's a youth choir, but they have leavers over 18 who still take part, and they're currently excluded. But now, because it's now a commercial activity, can they now invite those over 18s back to the rehearsal? Are
they rehearsing towards a concert or a paid?
Yes, they're saying it's a commercial activity.
Yeah, yes. Then yes.
Okay. Sorry, I've got to the point where people are now commenting on everybody else's. Should we expect all of our members to have a negative lateral flow test prior to joining up to rehearse together, even if it's socially distanced and in the open air?
I think it's like the vaccinations. You can't really demand people do this. I think you could suggest that it's a good idea, especially if you can get them for free. I see in Scotland as well as England now. You can't. I feel that you can't compel people to do these, and they're not accurate enough to warrant you to compel people. There's a ventilation question. Have you not got to that yet? About
Probably haven't, no.
Okay. No, it's I just, you know, does it have to be mechanical ventilation or something as simple as open windows? It can be open windows. Okay, so what you're trying to do is what you will do in your own house if you're ventilating, is trying to create a cross current. So if you've got a door at one end and some windows, then use that too. But you know, get people out of the room before you do that. So you might do half an hour, 45 minutes rehearsal, 15 minutes ventilation, and then the same again. The other thing is that so Jackie, I'm learning a lot about ventilation here. This was not my previously mastermind subject. So obviously heat, air rises. Okay, so you've got windows high up that you can keep open the whole time. That's marvelous, because the heat of your bodies will mean that whatever you're breathing out, which is warm anyway, you know, will rise, and so then it'll get sucked out of the windows. So this is an ideal situation, and one that possibly does apply to community halls and school assembly halls, etc., that don't have posh you know, mechanical ventilation systems. And you can use also fans in the corners of rooms to stop air stagnating there and accumulating there. Do use CO2 monitors to measure, and use them at head height, not on floor level. So.
Okay, thank you, Barbara. For years, we have lived with the possibility of catching flu at choir rehearsals. When do you think COVID will be considered in the same way?
I would hope this year, really. But I think one thing that we will be thinking about is, you know, flu vaccination really more thoroughly, because I think it's interesting. The NHS has long had each NHS trust has to report on the uptake of flu vaccine. You don't have to get it through work, and they do make it available. Whereas in social care, where you're just as much exposed and creating a risk, that's not really been promoted. So I think we will be thinking more comprehensively about how we get, you know, protection to people. And I think, but flu vaccines are reviewed every year. Some years they work really well, some years they don't work really well. But I do think the kind of staying away if you're not well is going to stay, and that the Skagit County outbreak was associated with somebody symptomatic attending. So I think we're going to have, you know, we're probably going to rethink how we do sort of social hygiene more generally, but and hopefully there'll be equivalent in that space.
Yeah, no, absolutely. I couldn't agree more. I think that is something that, you know, usually when you've got a cold, you kind of drag yourself to work anyway. This is going to be a new culture now, where actually when you've got a cold, we're going to definitely ask you to stay at home, right? So,
yeah.
Okay, thank you. There have been some test events with lots of people getting together, like sports events and music events. What are the things that at the test events that they're putting in place to minimise and/or track the rate of infections?
Well, I mean, I'm not hugely on top of these, but the Liverpool events that were run by Ian Buchan of Liverpool University, they measured. I mean, they were very good in that they measured travel, who you're traveling with, as well as the event itself. Obviously, they did. They tested people before they came. They knew vaccination status, all that kind of thing. I mean, they were really well done, and I think not so much to kind of the protections they put in, but to kind of understand where the risks sat at large scale events. I haven't, and the risks appear to have been very small. I think people who take part in things like that are different from the people who don't take part. So we need to be a bit careful about that. You know, if you sign up and you give all that data and so on, but clearly it was pretty reassuring.
Okay, thank you. The next question is, our group has many vulnerable people in it, including me, the leader. I'm thinking of doing an outdoor session for some of them, but I'm wary of opening it up to the maximum of 30 people. How much difference would it make if I changed that maximum and made it, say, 10, 15, 20 or some other number?
Well, I mean, from what I know about outdoor transmission, outdoors is very safe. And so long as you're not then, sharing glasses of wine and so on, I mean, then an outdoor event is just very, very safe. And it's not obvious to me that you'd make it safer by having a smaller number, so long as you're doing all the stuff according to the making music guidance, really. That would be my instinct. I mean, if you've got 15 distanced people outdoors, then then that is just extremely low risk, as long as they're not doing other things on the way there and on the way back.
Great. And Barbara, a question about, can you remind us the limits for an outdoor gathering? I presume it's in England. Yes, Scunthorpe.
No. Well, so actually 30 is a social gathering, okay? If you're in an organized activity, you can have multiple groups of 30. But so rather than think of it in those terms, we are encouraging you to think of subgroups of 1, and you can have as many of those as you want, provided you stick to the social distancing. So this is that number is what I'm saying applies in England, but in other countries of the UK, there are different rules. In Scotland, you will know that it depends on the protection level that you're in. So can you please check which one you're in? And there is very clear guidance about that. In Wales, outdoors, you can meet with up to 10,000 people, I'm here to tell you, but indoors only with 30. So go figure. That as long as you're distanced, obviously, with 10,000, I can imagine that's quite a few Welsh hills you'd be covering there.
Thank you, Barbara. Jackie, where do you think we'll be this time next year in terms of the restrictions we'll be living with?
I think it's really difficult to tell. I mean, I would hope that there will be, no domestic restrictions. We may well be having a kind of partial booster program by then, which will with slightly different vaccines. I think people, but even if we have very, very low absolute infection rates, I think a lot of people are going to take a long time to feel confident going back to things, even if objectively they're safe. And I think that that's going to be quite a long journey, and for many people, and I think that's a shame, but unavoidable now, really.
Okay. And also, Jackie, for people who are planning concerts, are there any advantages to waiting until January to start planning a concert as opposed to September, October? Will it be safer in January?
I wouldn't have thought so. Barbara, you might want to comment there, but I mean, I think it's likely that, as I said, that we'll be managing social hygiene slightly differently to how we did 2 years ago. There will be proper, things like sort of hand hygiene facilities and so on will stay. It's really difficult to say, but I mean, I would personally feel confident to go ahead in September. But there will be there will clearly be some COVID still around, and I think it's about how you manage doing it within those inevitable ongoing anxieties, because this isn't going to go away completely. And I think the question is, how do we manage the fact that there will be these kind of bubblings up, and they will be worse in some areas than others, and there will be places where we know that there's ongoing transmission, and helping people feel confident they know what will happen if. It seems to me that that's important. Whereas if you kind of feel that your choir might result in a whole class in a school having to go off, it feels very different. But I think normalizing contact tracing activity for the longer term and knowing what that looks like is going to be what confidence builds, because it isn't going to go away completely.
Okay, and looking slightly closer into the future, the current deadline for restrictions to be lifted is now July the 19th. What do you think things will look like then?
I hope that will go ahead, because I mean, people's behaviour isn't going to change overnight, and there is a kind of long transition to a kind of new normal, and it's difficult to see, if it waits much later, that transition could really. So I very much hope that it will go ahead, and that we will begin to sort of find ways of managing this for the long term. That's my hope.
Okay, I have reached the end of the questions, I think. Most of what I can see, I think you have answered now, but I'll just ask the last couple in case you have. Oh, no, wait, I've missed one. What progress has been made on the treatment of long COVID?
I'm not a clinical expert on that, actually. I think I won't answer that one because I'm just not on top of it enough.
Okay, so the questions I think you may have answered already are, is it still recommended to wear masks when singing outside? And should a large group of choral singers be requested to have a negative lateral flow test prior to rehearsal or performance? But I think you've covered those, but maybe just refresh us.
I think we have. Yeah.
I think we have, yeah.
So sorry, now more questions are coming in, so just give me 2 seconds to check.
Yeah, so this, can I just say, someone asked about what will happen with this event. So we would hope to publish the recording of this event. Dave, who asked this question, but also any new information from this will be fed into our risk assessment guidance and template. And you can already go and have a look at that if you're a member of Making Music.
Okay, so here is another question, which is, in the United States, the official advice from the Centre for Disease Control is that doubly vaccinated people can sing in a choir indoors with no social distancing and no face coverings. What is your response to that?
I think this, so, I mean, as someone who's also been involved in vaccine research, I would say that there's, it's a very different context. I think anti-vax is a much bigger social phenomenon there. And there has been, and I think correctly, in my view, there has been very much a sense that we don't want to discriminate by age, by whether you can have the vaccination, but importantly by age and deprivation, really. And I think so the government is clearly taking the view that we want to open up for everybody together. And I think that we don't have the level of, and confidence in vaccination as a public good, I think is, it also plays into that. So I think it's just a very different cultural context. In terms of objective risks, I think it's reasonable, but I think it is really important that we remember that, young people are only just, 18-year-olds are only just now being offered vaccines and won't be fully vaccinated for some time. And I think it is respect for that different situation is very important, psychologically, mental health, and in terms of discrimination.
Okay, thank you. A couple more questions popping in now. A number of our choir are not happy about wearing masks for singing, especially as church choirs have been told they do not need to wear them. Jackie, what are your feelings about not wearing masks while singing?
Sorry, I don't really have a view on that. I do think it's a shame that there isn't sort of consistent guidance. I think that, it seems odd that you have different rules for church choirs. Arguably, some church choirs will have a kind of more managed and greater distance from other people in the, but it does seem odd to have these kind of arbitrary differences. I don't know if Barbara might want to comment.
Well, only to say, well, firstly, there is guidance, certainly in England, very strong guidance that indoors you should wear masks. Okay, so I'm just putting that there. And it is possible to sing in masks. In fact, lots of clever people have firstly created singers' masks that have a way of keeping the fabric away from your mouth. And also a clever Liverpool University second year engineering student has created these silicone inserts that you can put in any mask to keep the fabric away from your mouth. So it is perfectly possible. So why wouldn't you, seeing that it is considered a useful mitigation? And secondly, I'm just going to try and find in a minute when someone else is speaking. There's been some research in Canada from a lady who has looked at the 24 super spreading choral events throughout the world and examined as to whether masks were worn at these events. And the short answer is no. And that, where masks were worn, no significant outbreak took place. So I'm just putting that there. I will try and find that now in a minute.
Great. And whilst we're talking about that, just some clarification, because I think mostly we're thinking about rehearsals, but do you think singers should also wear masks during a performance?
I mean, it depends on the venues, really, doesn't it? I would hope all this will change soon, but I mean, presumably at the moment you socially distance during the performance as well. That is required, isn't it? I think masks is a really difficult one, because I think I think we don't understand what masks do and don't do tremendously well. What they are is source control. If you are infected, then it stops, it limits the degree to which you spread virus around. And that is the advantage. And I guess the question is, I mean, we'll probably find there are people who will still wear masks long after they're required. And but I don't think there's any, personally, I don't see any really clear answers on that.
Okay, thank you. And sorry, I was going to ask another question, Barbara, to give you a chance to find your research.
Yeah, no, I've found it now, the link
okay.
to the research. So
okay, so the question I was going to ask is, would it be appropriate for the committee to ask members to report to them if they have become ill after a rehearsal?
Sorry, say that again.
Would it be appropriate for the committee to ask members to report to them if they have become ill after a rehearsal?
Yes, of course. Essential, in fact.
And of course, put it in the well-rehearsed app as well.
Yeah, but I mean, obviously, yes, because the committee would need to know, you might not have caught it from the rehearsal, but you might, and so they might want to review their mitigations and look at who you were in close contact with, etc., etc. So absolutely, I think that there's no question you're well within your rights to do that.
So Ed has just asked whether we encourage members to report this information to Making Music. So yeah, Ed, that's the app that we're talking about. But also Ed would like to know, has Making Music had any reports of infections happening at a musical rehearsal or performance?
So we haven't, but I understand that in the autumn, there were some cases of infected people accidentally attending rehearsals. But so I believe that there's some conversation going on at the moment about some researchers actually digging into those cases to see what they meant. So, but from my understanding, they did not lead to large-scale outbreaks, but there were cases where infected people, for statistical reasons, this is going to happen, were at rehearsals. So.
Thank you. And just a question that's come in asking for clarification about if somebody reports that they have symptoms or they've become infected, what is the group's responsibility in terms of advising people to self-isolate?
So they should let the group know, but so what we normally say is obviously what you should do is cancel at least one rehearsal so that there'd be 2 weeks gap to the next one, and tell the rest of the group that they should be particularly vigilant. It is tricky because they can't really share who it was, and also the aerosol transmission means that even if you sat at the other end of the hall from the person who was ill, you may still have got it because you're more vulnerable, whereas their immediate seat neighbour might not have got it because, I don't know, they're double vaccinated or they're not vulnerable. So the whole group should be told, but the likelihood would be small if you are socially distanced, wearing masks, cleaning hands, having one-way systems, ventilating, etc., etc.
Yeah, and I think it's both. I think that the guidance will change quite quickly. I mean, the PHE, the official guidance. I mean, I think it won't be too long before people start sort of nuancing it. So, I mean, and get a diagnosis. That's the other thing I'd emphasise really, because clearly people do get you know, these are common symptoms as well. And so I think just kind of watch the guidance changing, I think, in the next month or two, hopefully.
Okay, thank you. I believe I have reached the end of the questions. If you think I have missed your question out, please type it again into the chat now. But I think I've managed to get everything. Okay. What do you think the scientists and medics mean when they say we will need to learn to live with COVID?
I think people mean all sorts of different things by this. So if you listen to Professor Susan Mickey, she's saying, you know, everybody should carry a mask forever. I think for me and my sort of infection control, those of us who come, you know, from an infection control sort of background, I think we hope that this will move into the territory of other infectious diseases that we are used to dealing with, where we have tried and trusted and effective ways that people expect and cooperate with and feel they trust to manage those kind of resurgences that we are going to get, you know, where people, for whatever reason, where you've got significant groups of people who choose not to be vaccinated. I mean, I used to work, we used to get regular outbreaks from some sort of communities of anti-vaccination students who used to come over from the US, somewhere, you know, somewhere not too far from where I am now. And so, you know, is that, and we would then deal with that as it gets. So I think it's about having a standard approach that is no longer an emergency approach, that then allows you to deal with it without the level of disruption that we have now.
Okay, a couple more questions have popped in, thank you. Given that there is an expected third wave in the autumn, should we plan to be rehearsing outside through the winter?
So there's so what will happen, what clearly will happen is there will be more cases, and a higher proportion of those cases will be in younger people. They will not get so sick, but no doubt there will be a few people who are very unlucky. The extent to which there will be, but the link between needing to go to hospital or being seriously ill, even if not needing to go to hospital, and being a case is changing. I mean, that is being changed massively by vaccination. So while I wouldn't be saying, you know, don't worry about it at all, I think that the whole landscape is shifting. And I think, so if, you know, at the moment we're watching hospitalizations really, really carefully, but if that link remains broken, or and we're just not seeing the serious illness, then I would hope that it will be possible to do a lot of things much as normal, but a lot of people are not going to want to, you know. I think it's and that's going to be the case for some time. I mean, arguably, some people will argue that we need to vaccinate children as well for everybody to feel confident. I mean, you know, other people would say that's not a good enough argument for vaccinating children unless we're very sure it's completely safe. So I think, but yeah, that's the space I would see it in.
Sharon, there's a question still about commercial activity.
I was about to ask you that question, Barbara. Off you go.
Yeah, so the DCMS a letter to us, you know, the quote is, whilst it is for organisers and venues to determine how to operate in accordance with the relevant guidance and regulations, we would remind you that the limits do not apply to activity taking place for work or commercial activity. So yes, the singers may be unpaid, but if you are putting on a concert where you are selling tickets, this has been recognized by making music insurers as commercial activity. Or if your choir, well, or indeed brass band or whatever it is booked and paid a fee to appear at an event, that is, you know, activity for work. So in those two instances, you can rehearse towards such commercial activity in greater numbers than 6 and would be covered by our insurance policy. And you could obviously also perform at those events in numbers greater than 6. This was clarified initially with regard to the amateur choruses used by all the professional orchestras. So activity for work was the professional orchestra, but obviously the choruses that sing with them are unpaid amateurs. I hope that helps.
Thank you. Jackie, are you concerned about the possibility of new variants coming in from abroad over time?
We always have this idea that infections come from abroad, and if you remember that the French pox to the Spanish was the other way around. So syphilis, they always come from abroad. I mean, I think anywhere that people are ill, where there's a lot of COVID around, there's more opportunity for variation. I think it is possible. It is also possible that people will be sick for long periods, do well on treatment, and during the course of that evolve new variants. And these are highly variable viruses. I mean, I've been really struck by the holidays in Portugal is one thing, but we are a former colonial power, and many people have family links abroad, and I have been quite shocked by some of the kind of borders responses. I think the really key thing is that in the background, the Oxford team, lots of teams around the world were developing the boosters before we even got our first jabs. So I kind of think there is going to be a really long, there's going to be a long sort of progress, but this isn't going to go away. There will be other variants, but we do have the technologies to hopefully keep not too far behind. And I would, and I hope that we can stop thinking about, worrying so much about borders. But the other side of that is let's vaccinate the world. And I think people were very, were disappointed by the scale of the G7 response last week. And I think, that is really important to lobby our MPs. Basically vaccines is about keeping borders open for family life, and that really matters for people.
Great, thank you. Oh no, Barbara, I expect you'll answer that question in the chat, will you? So any more questions for Jackie? Because we are coming up to the end of the event. We've got 3 minutes to go. My clock's just changed, so we've got 3 minutes to go. If your question hasn't been answered, we'll make sure that we answer it in the follow-up email that we're going to send out to everybody after the event. But I think we have answered certainly all the ones that are for Jackie. The ones that can probably be answered by making music, we'll definitely answer in the email after the event. So yeah. Barbara,
Okay.
I think we've reached the end.
Wow. I think that's pretty spectacular. And thank you so much, Jackie, for taking the time to answer all our concerns. And it's great because you both have the medical perspective, but you understand how we all operate. So that's really, really valuable and appreciated.
Pleasure. Thank you.
So I think everybody have a good weekend. Well, it's pouring with rain here in London, so I'm not totally thrilled. And hopefully see you again soon for another event.